Hello, my name is Rebecca Guile, and this is my critical assignment on the Affordable Care Act presentation. For my first slide, I will describe what is the significance of public health and the interrelationship between the U.S. health and the public health. So, what is the significance of public health? Public health is the science of protecting and improving the health of people and their communities. This work is achieved by promoting healthy lifestyles, researching diseases, and injury prevention, and detecting and preventing and responding to infectious diseases according to the CDC. Now, the interrelationship between the U.S. health and public health and the healthcare system are interrelated because they both aim to have healthcare in organizations. The relationship between them will always focus on ensuring the best healthcare out there. Public healthcare focuses on diseases and health within populations by describing and discovering new diseases as well as formulating responses to them. They also focus on treatments and preventions as well as overviewing finances, operations, and evaluations. As for the healthcare system, they generally focus on overall healthcare delivery. Now, for this slide, you're going to see a picture from our book. We are going to discuss about distinguishing public health-based prevention strategies and curated strategies and major public health challenges and conflict within the U.S. healthcare delivery system. So, distinguishing public health-based prevention strategies and curated strategies. There are three levels of strategies preventions. First is the primary prevention, which is to avoid diseases from occurring. For example, immunizations to avoid diseases such as polio, because back in the day, polio used to wipe out a lot of people, and just like the Black Plague. But thankfully today we have those shots. Secondary prevention involves public health interventions in order to reduce incidence. And finally, the third prevention involves individual healthcare providers performing intervention for individuals. So, major public health challenges and conflict within the U.S. healthcare delivery system. Some major challenges and conflicts in the U.S. healthcare delivery system are large portions of the U.S. population that still remain without access to immediate healthcare, and unfortunately, it's still expensive for them in many cases, specifically in the marginal benefit. There are misaligned incentives, highly bureaucratic, large administrative costs, and there aren't sufficient primary care workers. So, key factors that influence the functioning of local and national healthcare. Many factors affect healthcare utilization. Different services needed affects just the use of health and utilization for specific populations. Other factors are poverty, geographics, race, ethnicity, sex, age, language spoken, which can become a barrier with, communication itself, and of course, disability status. Also, the ability to access care, whether it is available at a timely manner and if it is convenient and affordable. So, what are some solutions? Of course, we don't want to end up to the point where this image has it, but I hope you have a sense of humor. According to Stakeholder Health Solutions, some solutions are team up with independent transportation networks, specifically for the elderly who cannot commute or can't drive. Make use of mobile clinics to help patients who cannot leave or drive. It doesn't have to be elderly people. Create pop-up clinics and team up with retail clinics. Most importantly, it all comes down to educate and teach local communities about covered services. That's also very important for demographics in areas where English isn't the first language. A lot of people don't know things because they don't speak English. I grew up in Santa Ana, California, and the majority of population there, a lot of people didn't speak English. They'd always go to the English speakers to learn of things. So, the last one would be to set up a healthcare access task force with local hospitals and other community stakeholders. Now we're going to compare another country's healthcare system versus us, and I selected Britain, the UK. So, Britain has a national healthcare service, aka universal healthcare coverage, and that means everyone is covered. It is the Beveridge model, I believe that's how you say it, which is a single-payer national health service. It is government funded, generally by taxes of 17.5%, and there are no premiums. So, Britain has a traditional typified regimen of primary, secondary, and I believe that's how you pronounce it. Primary care level's domain is general practitioner. Secondary care is a specialist hospital-based clinics, and tertiary care is subspecialist. As for the US, they have a far less structure. Typically in the UK, patients have to be referred to a specialist by their GP, versus here in America, typically we can make that appointment ourselves. Continued. The UK pays half of what the US pays per person and has better statistics. They tend to have higher life expectancy in the UK, a lower infant death, and no one ever files for medical bankruptcy, versus here in the US, there's people that they're to the point where it's either, do I feed my family, do I pay my bills, or do I pay this medical bill? And if they don't pay their bills, then obviously they go to collections, and when they go to collections, it affects their credit score. And in America, the credit score is what makes you and breaks you. So, also in the UK, hospitals are owned by government. Doctors are also considered government employees as the government pays them. And they do succeed in primary care and emergency care. So how does this compare to the US? The US is funded by the government, private health insurers, and individuals. Unfortunately, not everyone is insured. The United States also possesses a multiplayer system in which a variety of third-party payers include the federal and state government and commercial health insurance companies. The United States spends more on healthcare than any other country in the world, and a large share of that spending comes from the federal government. Healthcare facilities are largely owned and operated by private sector businesses, and the U.S. life expectancy is lower than comparable countries. I mean, go Japan, they're #1. So, the Affordable Care Act. Understanding the Affordable Care Act, also known as Obamacare in the United States, it is a federal statute enacted by the 111th United States Congress and signed into law by President Barack Obama on March 23, 2010. It was enacted to cover all national residents. About 20 million people have gained coverage under Obamacare, and the uninsured rate is at an all-time low. The Affordable Care Act, ACA, was created for 3 primary goals: to expand access to health insurance, protect patients against arbitrary actions by insurance companies, and to reduce costs, which has helped senior citizens pay less for Medicare, their drugs. It has made contraceptives free, mammograms are free, and people with pre-existing conditions cannot be turned away, which is awesome. But what is the significance of the ACA to the field of public health? The ACA is an important significance to health coverage because it has made it affordable and accessible. It has also increased the number of Americans with coverage. The ACA has helped the public health field by helping disparities, improving access to preventative care, improving health outcomes, and reducing the nation's health spending. Since the enactment, of course, it has helped millions of people gain health insurance. The ACA also helped increase benefits and lower costs for consumers, provide new funding for public health and prevention, and of course, public health workforce and infrastructure, foster innovation and quality in our system, and much more. Pros and cons, basically the weakness and strength of the ACA. Some of the strengths the ACA has gained are, of course, as I keep repeating, Americans have gained more healthcare coverage. It was meant to be more affordable, which it became affordable for the really low income families. The best part, was for pre-existing conditions because it couldn't be turned away, and there's no limit for coverage on chronic diseases. Most screenings are covered, and prescription drug prices did drop. The weaknesses, though, in the ACA is higher premiums, specifically for middle-class Americans. We also had a tax increase, and the enrollment period is, we had a window where we had to enroll, so we had to keep an eye on that, and the employees were losing hours because if employers were scheduling their employees over a certain amount of hours, they had to provide health insurance. So that did end up affecting a lot of small mom and pop stores because they didn't have that kind of money. But some of the challenges that the ACA also faced was the Medicaid expansion access to healthcare under the ACA. There's a lot of gaps still in coverage and costs, specifically undocumented immigrants, which they also can't even receive Medicaid. So how did the ACA affect people and the U.S. healthcare delivery system? Even with the ACA, millions of Americans still lack coverage. There is a large coverage gap, and these gaps are the, like I said, undocumented residents and those who opted not to purchase coverage. Other gaps in coverage are the states that opted to not expand Medicaid eligibility. This is also a lack of expansion. A shift in measurement and payments has changed, as well as key changes to payments for providers under the ACA. They now focus on value-based payments to incentivize quality and safety, as well as to lower and increase efficiency. So what is the future of the ACA? At this moment, there isn't a specific bill that is, happening to replace it, but of course Trump keeps threatening about appealing it or changing it. Who knows? So what can we expect? We can expect more efforts to cut back on Medicaid and in the ACA insurance subsidies, and perhaps Medicare. So there is a possible opportunity for major policy redirection if Democrats can achieve control in the White House, Senate, and House following the 2020 federal elections, right around the corner, folks. So the ACA future remains unknown for now. My thoughts, opinions in this conclusion are, in my opinion, personally, I believe the ACA has more strengths than weaknesses. I strongly believe the ACA was created with good intentions to improve the quality of, the American health. The only issue is it did cause a lot of middle-class Americans, which is almost half the nation, to pay a higher premium. According to the Kaiser Family Foundation, middle-class people with incomes above 400% of the federal poverty line, equal to $48,560 for an individual and $100,400 for a family of 4 in 2019, who are not eligible for subsidies and may struggle to afford ACA compliant plans. I mean, if we can just correct those minor/major issues in the ACA, I really believe we can get the best out of it and it can work the way it was designed to work. And here are my references. Thank you so much for listening.